Hello everyone. This was a case of severe Fuchs dystrophy with vascularization of inferior one-third of cornea and a visually significant cataract. Posted this case for cataract extraction with IOL and manual DSEK. Here I start off with light cautery near the limbus, followed by scraping off of the vascularized and fibrotic epithelium. Rest steps of the cataract extraction are pretty routine. SICS is performed for cataract extraction as DSEK lenticule is planned to be implanted through the same tunnel. Watch what happens when the dye is introduced in the anterior chamber. Once the dye is washed off, there occurs double staining of the anterior capsule as well as the inferior one-third of the diseased endothelium. Now I begin donor graft dissection. After the initial incision, an initial pocket is created with the sharp crescent blade as seen here. This is followed by use of a blunt lamellar dissector till the dissection is achieved till the apex of the cornea. The dissection beyond apex of the cornea is performed using a curved lamellar dissector. Once limbus to limbus lamellar dissection is complete, the anterior cap is reflected back so as to enable the orientation marking of the donor graft. The donor cornea is then dismounted from the artificial chamber and on a Teflon block, the graft of appropriate size is punched out. The expected graft centration marking is done on the host cornea and the stripping of the desmids is carried out using a reverse Sinskey hook. This is followed by pre-placement of a 10-0 ethylon suture, followed by complete and thorough removal of the OVD in the anterior chamber. As seen here, I place 4 paracentral venting incisions so as to enable the draining of the interface fluid after positioning of the graft. Now, the lens glide is introduced into anterior chamber and its external portion is coated with sodium hyaluronate. The graft is placed on the lens glide and the anterior cap is now removed. In one swift motion with a dialer, the graft is introduced into the anterior chamber and the lens glide is gently removed without disturbing the graft. The anterior chamber is formed and the suture is tied off. Now using a blunt cannula, the graft opening is attempted. This is done using jets of BSS as well as stroking the stromal side of the graft. Now, a large air bubble is introduced under the graft. As the graft is well centered, a full chamber air bubble is now introduced to pressurize the globe completely. That's it. The suture is buried, the conjunctival incision is closed, and after 10 minutes, the air bubble is partially released. At the end of the case, a bandage contact lens is put on the cornea. The patient is doing quite well in the post-operative period. The graft is well centered and the cornea has cleared out, as can be seen here on the post-op day 1.